Now, bipolar affective disorder is a condition which can be quite severely impairing if it's not treated, because it does affect your functioning. The impact on relationships, especially when it's untreated, can be quite difficult to manage, both for yourself if you're struggling with it and also for your carers, especially when triggers aren't identified, when the symptoms aren't managed. It's not something you can just get over with sleeping well and eating well. You'll find that if you get into a depression, it can continue for months if you don't treat it. You'll find if you get into a manic state, it may get so heightened that you may get to a point where you do things you wouldn't ordinarily do, such as acting on some of the delusions you have. For example, if you think you've got a lot of money, you may start spending the money you have thinking it's a lot more than it is, and then regret it later on. So it's really important to get conditions like bipolar affective disorder treated, assessed, and managed. And it's important to not mix up or confuse milder forms of emotional dysregulation, which could be from other causes, mixed up with bipolar affective disorder. Now, bipolar affective disorder responds very well to medication, and often mood stabilizers are given. And mood stabilizers do exactly what they say on the tin. They will reduce the frequency and the intensity of the polarizing of the moods, so that you're more likely to have periods where your mood is balanced. And even if there are lows or ups, those lows and ups are much more manageable, and you can enjoy a much better quality of life. So what does this mean for you? What does this mean for your relatives? It means you can have better relationships. It means you can carry on doing your work, fulfilling your purpose. It means you can continue with your education. And actually, in the long run, you'll be healthier. Because what can happen is when people are in deep depressive states and in states of elation, their lifestyle goes out of balance. They're eating and they're sleeping, which actually on a long term affects their physical health and their mental health much more than if they got the condition treated. If you feel this video could be of use to someone else, please make sure you like, subscribe, and share.